4 in 10 Ghanaian women and 2 in 10 men aged between 15 to 19 have had sex. By the age of 20, 83% women and 56% men have had sex. Sexual reproductive health is very important. We cannot hide from it. We cannot shy away from it. We cannot use religion to cover it. We need to talk about it. We need to educate people. Yo, I am so grateful to you guys. The support I've had in the past 2 videos is amazing. I am lost for words, literally. It's such a blessing. I really appreciate it. Thank you so much. Thank you so much. My name is DorothyDadebo. I'm a community pharmacist here in Ghana, working with one of the largest pharmaceutical firms. This is my channel, and I'll be giving you tips, resources on health, pharmacy, and I'll be sharing real life stories of people managing these conditions and how they survive day by day. And before we start, let's use this video to also start a conversation with our peers, with our children, with our friends, with our parents. So let's check out this video. So when the condom breaks or you have unprotected sex, what are your concerns? Okay, so the first thing you think about is pregnancy, unwanted pregnancy, obviously. 2, sexually transmitted infections, yes. And then 3, HIV. So to start, let's talk about pregnancy. So the first thing to analyze when your condom breaks or you have unprotected sex is if the condom broke before or after ejaculation. So if it broke before ejaculation, you're sort of safe. But then if it breaks after ejaculation, that means there's been a transfer of semen. Hence, there's a possibility of pregnancy. So first thing to do is go to your bathroom, sit on your toilet seat, and try to push out the sperms from your vagina. That's like trying to have a poop. Sorry, you shouldn't say this, but that's like having a poop. Then you try and pee, but then it's going to try and clean the area around your vagina, like if there's any semen there. And then 3, you wash with water. Immediately after, within 7 to 2 hours, get an emergency contraceptive. So like I said, it's an emergency contraceptive. It's not supposed to replace a daily contraceptive. There's a difference. The daily contraceptive is one you take every day, okay? But then with the emergency contraceptive, maybe you're on a daily pill, but then that day you forgot to take your pill and you had unplanned sex. Then you take an emergency contraceptive. Or if you're not on any contraceptive because you do not have an active sexual life, but then just that day, for whatever reason, you did have sex, so then you need an emergency contraceptive. The emergency is talk to your doctor, your nurse, or your pharmacist to help you choose a contraceptive if needed. If you are sexually active, you need to make sure you are testing or you are tested for a sexually transmitted infection at least once a year. However, if you do change partners within the year, make sure you test again before you start having sexual intercourse with your new partner. So the morning after every downpour, I always have like 2 or 3 guys and some women coming in saying something like, "Ooh, I just had unprotected sex. I need something to flush my system." I never understand that thing. What do you mean by flush your system? And they'll be like, "Oh, infection, flush the system." But I'm like, you can't treat an infection if you don't have an infection. So what signs do you look for? A burning sensation, pain during sex, you have a discharge, maybe there's a sore on your penis or your vagina. These are all signs that you could be having an STI or an STD. So you need to go to your pharmacist, talk to him or her, or see your doctor. These infections can be asymptomatic. Like it could just happen, like you had an itch or you had a burning sensation once, twice, and then it went. It does not mean that the infection is gone. Any adult that is sexually active should be tested for an STD once a year. But we know that is not true. At least with my practice in the community, with my experience in the community, the ages I see coming for contraceptives, for condoms, can be a little alarming if you are very cultural. So in my opinion, once you're sexually active, especially if you're changing partners very often, or you have multiple partners at the same time, you need to check your STD status at least once a year. You need to do this for yourself. Why is this so important? Because an STD left untreated can cause a kidney infection, can cause a bladder infection, it can lead to kidney failure, it can cause infertility. I've seen it so many times where a normal urinary tract infection or an STI, which is very treatable, was left untreated or wasn't treated properly, and years later the people are faced with repercussions where they're trying to have babies and they can't. If you want to have an STI test, just go to any diagnostic center. You do not need a request from a doctor. Just walk in there and tell them you want to do an STD panel or an STI panel. So you need to tell them the kind of sex you're having, whether you're having anal sex, oral sex, vaginal sex, and then if you don't know what exactly you're looking for, they will help you choose which test will be applicable to you. Okay, so usually the tests are done this way. You have a urine test and then you have blood work, and sometimes they can do a genital swab. I cannot say how important this is. I know in Ghana it's not a practice. Nobody goes to do an STI test, but then you just come to a pharmacy and then you take medications from the pharmacist. If you're feeling some way about going to the lab to do your STI test, I know there's some home kits, so you can buy the kits and then you can do your own test comfortably in your house, but then they're not so common. Some places, pharmacies and online shops where you can get these things, right? So now you have no excuse not to do the STI test. It's very important to use condoms, guys. If it's not on, it is not in. You need to be very intentional about your reproductive health, because STIs are real. HIV is still real. So people feel kind of some way when you're talking about HIV, but then it's very real and we need to talk about it. Whenever you have unprotected sex, there's a chance of contracting HIV, especially if you do not know your partner's status. And it's very saddening too, especially for rape cases. It's very important to prevent or think about HIV prevention. Now in Ghana, we have something called the HIV PEP. That's human HIV post-exposure prophylaxis. So what happens is this: they assess your risk. The assessment has to be done within 2 to 72 hours after having unprotected sex, or after you've been raped, or you get the drill. So then after you're assessed, you'll be tested for HIV. You'll be cancelled before tested anyways, and then if you're negative, they'll still put you on an HIV antiretroviral treatment for 28 days. Now after the 28 days, that's like 1 month. Now if you went in today is week 0, so 6 weeks after you started the antiretroviral, they'll test you again. That'll be your second test. So you have a third test 3 months from the day you started your antiretroviral, and they have your last test 6 months from the day you started your antiretroviral test, your drug, sorry. So if at all these instances, so you're going to do 4 tests, after all these 4 tests they are still negative or HIV non-reactive, then you're HIV free. So you can see it's a whole lot of, I don't want to say stress, but it is stressful and it can really weigh you down. So please abstain if you can. If you can't, use a good condom. Check my tips, remember my tips about the expiry, about the oil-based lubricants. You need to follow all these things to avoid this stress. And I know for some people like that have been raped, it's going to be very challenging, but then hey, there's always light at the end of the tunnel. So please be hopeful. Don't go and jowly. My friend would say jowly. Don't go and jowly and have fun when you need to be cautious. Guys, you need to value your life. Enough said.